Hello everyone, it's Dr. Casper. We're going to be talking about the trunk and pelvis for part 1. I want you to read these objectives as a promise of what you will be able to do clinically after this lecture. By the end of this session, you should be able to describe normal trunk and pelvic kinematics during each phase of gait. That means not just saying the pelvis drops, but knowing when, how much, and why. You should be able to explain how ground reaction forces and center of mass displacement influence trunk and pelvic control. This is critical forces drive motion, not the other way around. You should be able to identify the primary muscles responsible for trunk and pelvic stability during gait, recognize common deviations, and their clinical implications. Propose specific corrective exercises, interpret EMG findings, and finally, apply all of this to real patient cases. If you cannot explain a deviation using forces and muscle function, we don't have a full understanding just yet. The trunk and pelvis function as the central transmission system of the body during gait. Every step requires forces to move from the ground through the foot, up the leg, across the pelvis, through the trunk, and then be balanced by their upper extremities. If the transmission system is inefficient or unstable, forces get dumped into joints and passive tissues. Pain often appears far away from the true biomechanical problem. Here, we are focusing specifically on what normal trunk motion looks like during walking. The trunk remains upright with minimal side-to-side movement. Excessive lateral trunk sway dramatically increases energy cost. The trunk counter-rotates opposite to the pelvis in the transverse plane. This counter-rotation works with arm swing to conserve angular momentum. You'll often see about 5 degrees of trunk rotation paired with arm swing. The primary muscles involved are the erector spinae and the abdominal musculature. Their role is stability, not producing large motion. The trunk is a stabilizer first and a mover second. Now focusing on the pelvis. It summarizes in all 3 planes. In the transverse plane, the pelvis rotates about 5 degrees forward and backward with the swing limb. This effectively lengthens stride without increasing joint demand. In the sagittal plane, the pelvis oscillates between 2 and 4 degrees of anterior and posterior tilt. In the frontal plane, pelvic obliquity occurs. The pelvis drops about 5 to 8 degrees on the swing side during single limb stance. The overall function of pelvic motion is to smooth center of mass displacement, lengthen stride, and increase efficiency. Reduced pelvic motion almost always increases joint stress somewhere else. All right, now going through ground reaction forces. The mediolateral ground reaction forces are small but essential for balance. These are managed through subtle trunk lean and pelvic drop or elevation, especially during single leg stance. Vertical ground reaction forces follow a double peaked pattern. One peak at initial contact and one at push-off. The trunk and pelvis must absorb and transmit these forces efficiently. Anterior-posterior ground reaction forces involve braking at initial contact and propulsion at push-off. Trunk and pelvis coordination determines how smooth forward progression is. When ground reaction forces aren't controlled, joints take a hit. The center of mass normally follows a smooth sinusoidal path. Vertical displacement is about 5 centimeters. Mediolateral displacement is about 4 centimeters. Pelvic rotation and trunk counter rotation reduce excessive center of mass displacement and conserving energy. Excessive trunk lean or pelvic drop disrupts this efficiency and increases energy expenditure. Inefficient gait often shows up as fatigue before pain. EMG helps us understand timing. The erector spinae and multifidus are active at initial contact and pre-swing to stabilize the trunk. The rectus abdominis and obliques assist with trunk rotation and pelvic stabilization during swing. The gluteus medius peaks during mid-stance to control contralateral pelvic drop. Quadratus lumborum assists during swing, particularly with pelvic hiking when needed. Normal strength does not guarantee normal timing. This concludes phase 1, and then we'll go into the second phase of this lecture.